All right, Jennifer, I'm turn it over to you, and thank you.
All right. Hello, everyone. Beth and I, a few months ago, started conceptualizing a webinar series talking about integrative clinics. And during the brainstorming, we kind of realized this is really a wonderful opportunity to have a joint venture between the working groups and PIHTA because there's so much overlapping content. And through that initial discussion, our idea was to have, at least for the first webinar, a panel of administrators or faculty members to answer questions about best practices in integrative clinics. As I alluded to earlier in the conversation with Bonnie, my involvement recently has been looking at the integrative PCMH clinics, specifically with NDs as leaders. So I have some specific interests that I am interested in learning more about in terms of hiring and collaboration and how referral occurs, billing, credentialing if appropriate, what's happening with burnout, how are these clinics addressing that, what about the role of the patient and patient advisory panels and patient satisfaction surveys, as well as kind of self and clinical evaluation, as well as the use of EHRs, which is kind of a perennial hot button issue. So we're still very much in the planning phase of this. Beth and I are kind of conceptualizing right now how many webinars we should plan around, and all of this is contingent upon the end goal in terms of utility and content. So with that said, I'd like to maybe have a little brainstorming session or open up a discussion around what we want to glean from this series and what themes we might be interested in exploring during the webinars. This, of course, would help us drive, in terms of who we would select in terms of the panelists. So that's just kind of a very 101 overview. Beth, did you have anything you wanted to add to what I shared?
Yeah, thanks, Jennifer. Great introduction. And the step it went beyond after Jennifer and I thought this would be a good area of overlap is that Barry and Marcia outlined what this sort of webinar series might look like. We filled out the project sheet that we had started filling out in olden days for new projects, and then we brought it to all the working group co-chairs and started talking about it Friday, and there's a number of questions that came up that we were just in the very, very beginning stage of this exploration. And I went back and looked at some work that the Clinical Working Group had done in 2012, and then I had attached this to the email notes that many of you received. And this is a list of questions and themes that this group had come up with in years past. And for those of you who were on the group at that time, you will remember that when we took these questions that many people in the group wanted to know about how integrative clinics work, we then thought about finding vignettes or stories that illustrated in our actual experiences successes and challenges that clinical working group members had actually encountered in their own clinics and their own experiences. So I kind of revamped and put together what I thought was still relevant into a document that we can refer to during this conversation or another if this is something that both the working group members and speaking with Liza, our executive director, and our executive committee and board, and everybody decides to move forward on, that might inform that process. So I can either, actually I don't think I'm going to leave this on the screen because, actually what I can do, I can leave it on the screen and take notes as people talk about questions. As Jennifer was asking, what are some questions that you have that you'd like to hear people talking about, and that would help in the process if we do move forward with this, with who we would invite on, and as Jennifer and I were talking just I think yesterday, we might want to organize this in themes. So if we do decide to have a series, we can group the issues and the speaker or panelists into different kinds of themes and have a plan for it. So these are all, we're totally in the beginning stage. This is just questions, and so I'll stop speaking now and listen to anybody's feedback or questions or ideas. We can do a go round if people are feeling shy. So it kind of sounds like that. So why don't we start with Martin? Not that you've been feeling shy, but just that we haven't. We'll just start off the ball with you because you were speaking earlier, and then we'll give everybody a chance. So what do you think of this idea, and are there specific questions that you would like to have addressed if we did move forward with this kind of webinar series?
Well, yeah, I mean, I'm looking at the different questions here. I mean, I think the issues of payment, you know, and how that gets resolved and the different ways that that can get addressed, you know, is an important one that needs to, I think it should be explored, that, you know, people that maybe don't have as much experience with these types of setting up these types of integrative settings could benefit from hearing how they get their, you know, services paid for. Whether, you know, supervisors, you know, get hired on as staff versus, you know, are just paid as, you know, by the college, that kind of stuff. Those are all important considerations from my perspective. I think, you know, I still want to go back to, you know, the question that I had asked earlier, because I do think that, you know, we need to continue to keep in mind, you know, how, as we expand these types of integrative opportunities, how we can ensure that the students that are going through them take those specific experiences and competencies that are developed in hospital, public health clinic settings, and how they effectively translate them back to their private practices. Because that's what most of them are going to be doing. And so I'm very cognizant. After coming back from the last, you know, council meeting last month, you know, the whole issue of gainful employment, as I'm sure most of you have heard, is just, you know, it dropped like a ton of bricks at the council meeting. For-profit schools are very concerned, but all of us are very, you know, concerned about how are we going to essentially justify what we're doing. And I think
you know,
keeping that in mind is really important.
Martin, I just want to say, because I thought about that after you talked again, this is Bonnie, but having been in this setting now since 2010, I have to say that my confidence in talking to any kind of provider is exponential from where it was where I started, where I was pretty concerned about how I was going to navigate the whole system. I did not have, the only prior experience I had at school was I did an externship at the Haight-Ashbury Free Clinic, because that was the only externship site that we had at that point. And so outside of my time here at this community health clinic, when I do work, the other half of my working life is in my private practice, I can now sit down with a new client and do a much more competent past medical history, give them an idea of what other care they might need, and hopefully make appropriate referrals in a way that I was somewhat familiar with, because I was already in practice as a massage therapist before I went to acupuncture school. But it's a much more immediate, confident, and efficient process for me. And that means that I can also talk with those other providers that I might have in my referral community outside of the clinic in a much more competent way.
Thank you.
So
thank you for that, Bonnie.
I think that's a really valuable
Well, I'd like to hear more about
Yeah.
what people would want to hear in this integrative clinic. So I've made a note of that, and I think the translation of how we go from integrative experience to solo practice is extremely important, and I have other things to say about that at a later time. But Steve, do you have anything you'd like to add to what you would want to see if we did such a series about integrative clinics?
Yeah, I think I've known of clinics that have been put together where the physician was sort of the anchor of the clinic, and then they offered services like acupuncture, chiropractic services on top of that. And then there's the setting that might be more like Bonnie was saying, which is a hospital-based setting where it's a larger institution, and maybe there isn't a system for where patients come in and get directed to these different specialties. Yeah, I mean, I guess trying to define what we're talking about, are you thinking more in terms of like a hospital setting, or is it sort of a standalone clinical setting that has maybe the physician as the anchor, since they can get reimbursed for more services and thus generate more of the revenue for the practice?
Good question. Let's see. Melanie, are you still on the call? Melanie, do you have any thoughts?
All right.
If you're speaking, you're on mute. Okay, because it looks like Melanie's still on, but maybe she had to drop off. Okay. All right. Marcia and Barry, I don't know if you want to say anything now because you've had such a great role in the planning out this possibility, but is there anything that either of you would want to add now about your interest or any other thoughts?
I don't have anything. How about you, Marcia?
Just that there are so many ways to approach a lot of these issues. I mean, I've worked in a hospital setting, and we tried many different options, all with different levels of success. So I think the idea of having multiple responses to this, because it's going to vary with not only the setting and the disciplines, but also the personalities can make or break the process. So, yeah, I'm excited for each one of those. I mean, obviously, we've been talking about each of those questions for quite a while and how to approach them. So, there's that whole question about gatekeeper is intimately involved with your documentation and intimately involved with your payment. Those don't separate out well. So,
thank you.
Yeah.
Good. And then Liza, we have a long agenda of good things to talk about, and one of them will be the possibility of this project and other projects that are going on and any possible overlap, and making sure that we're well connected to other things that we can feed into or can feed into us. So we'll be talking more about that.